Welcome back to the Valley Wellness Podcast, sponsored by the Valley Hormone and Wellness Clinic. We're back here again with Tennille Cloward and Jen Krebs. If you guys just want to give a brief introduction of who you are one more time, if you want to go first.
I'm Tennille Cloward, OBGYN. Work at Valley Women's Health currently. I've been serving women in the community for over 16 years.
Good.
I'm Jennifer Krebs. I'm a certified nurse midwife and APRN. I've been practicing in the Valley here for 15 years.
Okay. And I'm Sean Haskett. I'm a board certified OBGYN. Super excited today. This is a fun podcast. This is one that I think for me is something I believe pretty strong in. We're going to focus a lot on nutrition and weight loss today. Obviously, in a 45-minute podcast, we can't talk about everything. But we're going to try to give some hopefully helpful feedback and input for people. And once again, just a reminder that this is not a doctor-patient relationship. We would encourage you to see your healthcare provider before engaging in any fitness or diet programs for yourself. But yeah, let's get started. I'm going to kind of ask questions and let you guys do your thing. We're going to get all your great wisdom in this arena, which I know both of you are really, really knowledgeable about. So I'm excited about it. So kind of just a few questions that I get a lot. I think one of them that's super common is as people age, things start to change. And I get that question a lot. Hey, I'm not doing anything differently, but I'm all of a sudden gaining weight. Is there something wrong with my hormones? What's wrong with me? What is going on?
That question is also one that I get very often. And I think it definitely needs a conversation. You know, there might be something going on with hormones, and that's always something that should be ruled out initially, easily done with some labs. But a lot
and
of
what
the time,
hormones are you talking about?
more specifically like thyroid.
Mm-hmm.
That would probably be the only one that I would test if I have a woman complaining of weight gain despite no changes at all. You might have a different answer.
Well, I'm a little bit of a geek. But usually when this question comes to me, because I think this is probably among the top 3 questions that we have asked clinically in women's health. When that question comes to me, I usually clarify what they mean by hormones, because usually when they say my hormones are off, they think estrogen, progesterone, testosterone.
Right.
And I think, sure, those are really important. They're less clinically applicable to test many times. But the hormones I start thinking are, like you said, thyroid hormone, insulin hormone.
Mm-hmm.
I start to think about muscle mass, sleep deprivation and sleep disturbances, hormones like cortisol, which also is one of those that is difficult to test. But these are all the hormones outside of estrogen and progesterone that I really start to think about
That are going to affect
weight.
their weight.
Mm-hmm.
But correct. So thyroid would be one you would test.
Mm-hmm.
Insulin would be one you would test.
Mm-hmm.
Possibly cortisol. But the
it's really hard to
hormones,
accurately test
it
cortisol.
It really is. I don't test.
Usually ask questions that would indicate whether or not their stress hormones would be high.
But a lot of the time, we test these things and they come back. Maybe your insulin can be a little bit high, but that likely is in conjunction with this weight gain and the metabolic changes that are going on. And a lot of the time we have these women come in and ask these questions and their hormones actually come back normal. And so then it's a conversation, right?
Yeah.
So then it's a conversation about what can be going on as a result of their reproductive hormones changing. And even though we suspect a change in these reproductive hormones that can lead to changes in their body composition, we don't test them necessarily because it's hard to get a result that's going to give us guidance because of how they fluctuate throughout the day, throughout the month, throughout the year, all of that.
They're not very clinically meaningful.
No.
Yeah, and I mean, the interesting thing is the reality is, your hormones are changing as you age.
Yeah, I tell them they're changing because of your proximity to the age of 50.
Yes.
Period, the end.
Yeah, and unfortunately there isn't a test for every hormone that goes through your body, and there isn't a medication for every hormone that changes as you age. And there are ways, I feel like, to help kind of deal with this question, to kind of move forward. And the answer isn't always just, here's a drug that's going to make you better. sometimes there's a lot more detailed description in what's going to happen kind of from there.
Mm-hmm. And because their hormones are changing because of their proximity to the age of 50, I like the way you say that, giving them hormones in the sense of balancing out their reproductive hormones, trying to get those reproductive hormones back to a maybe 35 self-age range can help minimize the changes that are going on, but are not going to necessarily make you lose weight. But it can help you at least get your body where it needs to be so that you can improve and you can stop gaining weight the way that you have.
At least stop the downward declines.
Yes. And get to feeling better, because you do want to do more when you feel better. So I think a part of the question usually is they don't feel right, like they feel off. And so that question has more to it than just a number on a scale, I think. And so it's not a simple, quick answer. It does take a minute to kind of go through what ways to kind of help someone feel better. Exactly. Okay. Well, since we're talking about weight loss, I think we have to talk about diets. A question I get all the time is, what diet should I be on?
I don't have a favorite diet. Do you have a favorite diet, Jen?
Yeah, my favorite diet is eat whole food. Years ago, I read this book by Michael Pollan, and the summary of what he said was eat food, mostly plants and not too much.
Yes.
And I don't necessarily agree with the mostly plants, because protein is such an important component. But the eat food thing, so much of the food that we are surrounded by and that is so easily available to us is highly processed, which means it is very deficient in nutrients and it is very high in calories. So when I talk to my patients, I say, make sure you're eating food. So much of what is out there isn't actually mostly food. So if you're eating whole foods, most of the work is done for you already.
Exactly. And I do feel like a lot of people don't even know where to start when they're looking at a diet. I don't like the word diet though. Mm-hmm. I feel like it's really just learning how to eat. And it's not, you're going to go on a diet and you're going to lose weight and then you're going to go back to your old ways. No, you are going to learn how to eat. Mm-hmm. And you're going to learn how to eat foods that are unprocessed and that are high in protein. And women don't really know how to focus their meals, where to start. And that's a very important conversation to have.
Yeah.
I do like apps that women can use that can kind of help them track what they're eating, what they're getting. My favorite app, I don't know if you've ever used the Chronometer, but it's a free app that you can get where you input everything that you eat and it tells you what you're getting in terms of your fats, your carbs, your proteins. It even will break down the nutrients that you're getting and your fiber, which is very important for women. And so I don't feel like there's a diet that women should follow. I feel like there's a way of living. There's a way to eat that needs to be learned.
And there's a lot of cultural components to that. And I do think that every cultural component to food can be incorporated into your life in a very healthy way. As long as women are getting enough protein and fiber, like you said, whatever sits best with your gut. If you have food intolerances, if you come from, a Latin American background and there are specific foods that your family all eats together, there are ways to incorporate any of that into something that is healthy for you, that's going to help maintain your nutrition, your energy, and most importantly, as we're going to discuss all day throughout this whole podcast, most importantly, your muscle. Yeah. Because that's the largest component of maintaining a healthy woman's lifestyle as we go forward.
I will throw this in there. More than just cultural things, personal preferences.
Yeah.
I eat a very healthy diet, but I will never deny the fact that I have a cookie dough ball every single day.
And because I love jalapeno bacon cheeseburgers.
I love them. And I will work that in to my calorie content. I will make sure I'm getting my protein first. I will reach my fiber goals. And I will end with a cookie ball.
You know what?
Nice.
Good for you.
That's good.
I support you.
So there are definitely ways to eat healthy and get what your body needs and not feel completely
and still
deprived.
have joy.
And still enjoyment in what you're eating, for sure. And I kind of like to change that perspective from diet to nutrition. So I like to change the word. So let's talk about nutrition, not what diet should I jump on? There's lots of very, buzzword diets out there that people jump on. And I think sometimes it's triggered because there's a wedding coming up or some big event. So they want to lose 20 pounds and they go on some kind of very restrictive, non-maintainable diet. And that's kind of their strategy. So they're kind of yo-yoing up and down all the time. And it's just not really a healthy way for your body to function. Your body needs food. It needs vitamins. It needs minerals. It needs calories. And that's, it should be your nutrition should be, how do I help my body function at its best?
The other thing they're not realizing though is when they go on these extreme diets and they're watching the scale, they're losing weight. But the reason they end up yo-yoing and going down and going up and probably going down and going even higher when they go back up is because they're restricting so much and they're losing muscle. And so they diet, they lose muscle, and then they gain weight and they gain back fat.
Yeah.
And so they end up at a place where their muscle mass is lower, and your muscle mass is so critical to your resting metabolic rate and to your longevity overall. Muscle is the organ of longevity, in my opinion, and it's so important to pay attention to that as you are trying to lose weight if that is a goal.
Well, your opinion is very evidence-based.
Yes.
But yeah, I don't think people realize that as they go up and down like that, every time they go back up, they're actually at a less healthy place than they were at when they were first overweight, because every time they go down, they lose muscle, and then they come back up and they have less muscle than they've ever had before. And it has a huge impact on their long-term cardiovascular health, their long-term brain health, their long-term bone health. So maintaining a sustainable nutrition habit not only helps you in the long run, but in these times when we have weddings to go to, or we have 5-year-olds having a birthday party, we are more metabolically flexible when we have a stable nutrition pattern. So we withstand periods where we cheat a little bit.
Right.
And I usually tell people, I have an 80-20 rule. If you're doing well 100% of the time, you have anxiety and there is no joy in your life.
Yeah, that's tough to maintain.
Perfection is 80%.
Yeah. That's a good,
and it is sustainable when you have those periods where you get to deviate from it a little bit.
Yeah, and I like how you brought up like apps or things that help. I think probably one of the things that helps people be successful with their nutrition is getting help, having someone be a part of their process, whether it's a healthcare provider, an app, something that helps motivate them. We have found in study after study, when there's some accountability, your success rate goes through the roof. There was an interesting study happening when I was in med school with the fire department in my area. They literally were just having them come once a week and get weighed and talk about what foods they ate over the week. And the percentage of them that lost weight and ate healthier skyrocketed. It was pretty amazing. None of them were given a specific diet to do. They just talked about some general principles of nutrition and then had them come once a week to kind of check in. So just having some accountability or someone to work with or a team member actually makes such a huge impact on your ability to be successful.
And I can speak to that truth as well. I mean, just being a mom, I've got 5 children, and they would all be sitting at the table for breakfast with their pancakes. And I'm sorry, they look amazing. And eating a bite off of every one of their plates doesn't count to me.
As long as it's one
But
bite.
if you give me an app where I have to write down everything I'm eating, it counts. Yeah. And so you start paying attention to what you're putting in your body, and it will affect what you're eating. But it's a nice way to kind of even get a baseline. You have someone come in and they want to maybe lose some weight and they want to know, well, how many calories should I be eating? If you give them a way to track what they've been doing for a 2-week time period, and who knows, maybe they'll lose a little bit of weight over that 2-week time period once they start to really pay attention. But if they're stable, that gives you a set point to then help them know where maybe they should focus their efforts and make adjustments and how many calories they should be eating if they do want to lose weight.
Yeah, and I think everyone's coming at a different level, right? Some people are coming and they're maybe 10 pounds are trying to figure out how to get through, and others are morbidly obese and really struggling with diabetes and trying to figure out what to do, and they're sedentary. So there's just very different levels.
Which is why I loved what Tennille said too. People have all these macro differences between them. Their cultural differences, all these, but everybody has their individual differences as well. And that's kind of the idea behind what we're trying to do. Create a place and a space where people can come and have an educated healthcare provider that looks at them as a person and their life and what their body can handle and what their specific needs are, and cater a plan that's designed for them as an individual.
Right. That has follow-up, that they come back and you can see how we're doing and actually make some progress and see what the progress is.
Accountability there.
There's accountability and there's help. And you're like, what's working? What's not working?
Yes. There's being seen.
Yeah. I think so too.
Which I think is a huge component that's missing in our healthcare system. It's in and out, and you're put into a box, and you are compared to what the textbook says. Right. And when you come in and you get a personalized plan and somebody that takes the time to see you, it makes a big difference in outcomes.
Yeah, and it is frustrating because unfortunately our training really tries to put all patients into one box. And that's kind of how we're trained through medical school. And it just doesn't work like that. Everyone has a little bit of a different background, has a little bit of different things that are impacting their life. So being able to tailor the treatment to them as an individual, I think really makes a big difference. Mm-hmm. Well, since we've talked about diet, let's talk about exercise. I think I get a lot of questions like, what is the right amount of exercise for me? Does that change as I get older? Can I just do anything? Is there too much? Is there not enough? Like, what is the recommendation for exercise?
This is also one of those things that gets tailored to the individual. The CDC definitely has recommendations: 150 minutes a week of aerobic exercise, with some strength training 2 to 3 days a week in there. I would argue that especially for women, and especially for women over the age of 40, we need to focus more on strength training and muscle mass. And this is something that you and I both especially have really emphasized with our patients. Mm-hmm. I tell all my patients that strong is the new skinny. I want you to have muscle. It's going to protect every component of your health, your brain, your heart, your bones, and it's going to help you feel better. So, I would say for most of my patients, time is a really, really big issue. I'm a single mom. When somebody looks at me and tells me exactly how much time is required for me to have optimal health, if looks could give middle fingers, right?
I'd be a little pushback there.
I think fantastic. You put 25 hours in a day, and I can do that. Yeah. But there are lots of little ways that we can help women think of creative solutions to this. Exactly. So, stay active, keep moving. I love things for my really busy patients like weighted vests to wear while they do laundry and they do household chores.
That's a great idea.
But the emphasis is always on strength and mobility.
And, I was very lucky to grow up in a house where strength training was very important. And I had as a 15-year-old, very tragic event where I didn't make the cheer squad, even though I'd been on the cheer squad the year before. And it was really hard for me, but it opened up this space for me to be like, okay, what am I going to do? And I started going to the gym, and I would go with my mom or I would go with my dad. And it was always about strength. It was never focused on cardio. It was always about strength. And so I was taught that at a very young age, which is nice because most women my age were taught it was all cardio. You go
culturally, it's very different. Yeah. We're like, go for a walk.
Yes.
Go for a run.
It was all cardio based. And luckily we're learning that your muscle is more important than your cardio fitness is very important, but you can't forget your muscles. You have to, and a lot of women used to be afraid that if you lift weights, you're going to look like the meatheads that you're lifting next to. Yeah. And that's not true.
And even guys can't get to that point without using a bunch of performance-enhancing drugs.
In the absence of anabolic steroids.
And I've been lifting weights forever, and I cannot, for the life of me, get myself to look like the people standing next to me. So as a woman, it just doesn't happen, but it's very important for their health.
Yeah. And the nice thing about weight training, actually at most levels of fitness, some weight training is really not that hard.
It prevents injuries.
Yeah.
For distance runners.
I can think of when I haven't run for a while and all of a sudden I go run. The next day, I don't even want to get out of bed. I'm so sore. And yes, weight training can make you sore, but you can start at a very like low resistance level, and it can be something that even a beginner who's never lifted weights can get into pretty quickly at pretty much any fitness level. And in the night, it's because you can adjust how much weight you're lifting. You don't have to show up and lift what everyone else that you're seeing in the gym is lifting.
And for some of my patients, going to the gym is like so special,
Really?
and they just love it. They love it. They love the
And others
atmosphere.
not
And
so
some of my
much.
patients, they show up
They hate
and
it.
it's humiliating.
Yeah.
You know, they look at all this equipment and it looks terrifying.
frightening.
And they look at all the
Yes.
people there and they think,
I don't know how many times
I don't know how to
seen
do this.
these young girls at the gym, and they're like trying to figure the machine out, and I will just go and I will show them what to do because they don't dare ask, and they're so like they're wanting to try. And you know, I have a really good friend who is like, okay, I'm trying to get into this weights thing, and how do I even do a dumbbell curl? I don't know. But luckily there are a lot of resources online that can help. There are trainers that women can hire to, if they don't know how to do these sorts of exercises, to start into the actual, you know, resistance training world.
Yeah. I mean, for me, I love, like, that is my alone time. I don't like being where there's other people. I have my big noise canceling headphones. And I have my garage and a few little pieces of equipment. And I know for some of my
Which
patients,
is all you need.
Yeah. For some, it
Yes.
really doesn't need to be complicated. And usually when I'm exercising, I don't have the brain power to come up with my own exercises. I have a few people that I really like that I follow online, for ideas for strength training. The work's already been done for you. You know, some of my patients are like, well, I'm 60 and I have this knee injury. And I'm like, go to YouTube, put 20 minutes strength training, no equipment, knee injury.
You'll get it.
Like, the work is done for you.
It's everywhere. It is everywhere. I do still feel like having some accountability does sometimes help if you're really struggling. So if you're really struggling to get yourself moving, have a friend that you talk to and say, hey, let's do this together. I think that makes a big difference.
And
or a trainer.
For some of my patients, initially, we have
professional.
weekly visits.
Yeah.
And then we move it to monthly. And then, so there's, you know, and so we can problem solve.
Right.
There's really good research behind exercise snacks. This idea that after a meal, you'd participate or before, right? In order, you know, in some sort of increased heart rate, muscle building activity. You know, if you need to go into the bathroom at work and do 30 squats, done. Super, you know, no equipment, builds muscle, gets your heart rate up.
And that is also something that, you know, is going back to weight loss. You know, when we have women who are trying to lose weight and they do start cutting calories, staying active throughout the day, that non-energy activated thermogenesis, just that movement that you're doing throughout the day, whether it's actually predetermined, I'm going to go and do 30 squats in the bathroom at noon or whatever, or it's just making sure that you continue to move around throughout the day, standing, getting your steps. A goal of 8,000 steps a day is a really good goal for women who are trying to lose weight outside of this structured exercise that is very important.
Yeah. And I mean, realistically, it can't be said enough. Exercise is what I think has the greatest impact on your quality of life as you age. If you skip this part, it is something you will pay for. And it's not too late. You can be 85 years old and start exercising. You can be 95 years old and start exercising. We'd love for you to start exercising when you're 35 or 40. Like, we'd love it to be earlier because it definitely will have a longer impact on your overall quality of life. And it's just being able to function. Like, I am less interested that your patient has to look perfectly like a magazine picture than I want you to be able to go play tennis and go on hikes and go swimming, play with your grandkids someday, or be able to function and travel and do fun things throughout the rest of your life. And
I think that's an important thing to keep in mind as we go through all of this with our patients. There's so much of an emphasis on weight loss, and it's better to have an emphasis on health. But on top of that, I think it's better to have an emphasis on why that's important, because, you know, if we're just trying to get you a stronger pulse for a longer period of time, we have failed you. Really, the purpose is so you can have the energy and you can have the strength and you can have the mobility to interact and build quality relationships with the people that you love. And usually that's the kind of thing that brings people to me, is this moment where they were meeting with their primary care physician and they were diagnosed with diabetes or cardiovascular disease. And suddenly they thought, I want to be there for my grandchildren. Mm-hmm. Or they go on some family vacation and they're all trying to walk to the beach and they can't make it.
Yeah.
And it's these really intense moments where they think, I can't be with the people that I love in the way that I want to be with them. And I need to change something about my life. So making sure that throughout the process, we keep that underlying, very meaningful why. Otherwise, it starts to become about a number on a scale. And that gets really, really discouraging. That is not, that is not a why to do anything.
Yeah.
And you will lose your motivation very, very quickly.
And there are also, exercises that can be tailored specifically to things like that. Mm-hmm. I don't know about you, what your regimen is like, but I know I have a day week where I'm doing things that are functional, that mm-hmm. I want to be able to get up on my counter to get that tall bowl that's up on the very top of the cupboards by myself. When I'm 70, I don't want any help. I want to be able to step those long distances. I want to get off the ground by myself so that I can play with my great grandchildren even. And there are things that can be done just to help keep that functionality as well.
A lot of my regimen, and this, speaks to how it needs to be specific for the individual, has to do with the fact that I have autoimmune arthritis in my whole body. I've got ankylosing spondylitis, rheumatoid arthritis, and you guys have worked with me long enough that you know all these things. And have been able to manage it without medications for a significant period of time now. But my big concern is that I have a very real degenerative joint condition. And I think about being 80 and I want to be able to get up off the floor. And that idea affects me so in a way that is pretty significant. So when we talk about longevity, one of the better indicators of longevity is your ability to go from a lying position on the floor to a standing position without the use of your arms. And I actually practice that every day. And my exercise focuses on weighted mobility, keeping mobility in my joints, building muscle, and maintaining balance. So it's very much catered toward muscle, stability, and maintaining range of motion in my joints.
Yeah. And it's interesting you bring that up. And it's, I get patients who are like, oh, well, I have back pain or I have knee pain, so I just don't feel like I can exercise.
You have more of a reason to exercise, friend.
Yeah. And I don't think people realize that a lot of times the reason joints are sore is because the muscle and support around those joints is so weak that it's contracting around the joint. And that's part of sometimes why they're having pain is there's just no strength around that area. So for sure, if you have an autoimmune disorder or joint pain or some medical problem that feels like it's inhibiting your exercise, you even more need to be doing exercise.
It's not less of a reason.
Yeah.
Right.
It's more.
And it might be baby steps to get them
for sure
to where they're feeling better, but it can happen.
Yeah. And I think that's the whole point of having an opportunity to meet with somebody and
tell
see
your story.
Where they're at. Yeah. Let's find out what's going on with you. And then that can be tailored to them very individually, which I think is a big part of why we're doing kind of what we're doing is we want to give people the opportunity to be heard, to really tell us exactly what's going on. And instead of having a cookie cutter answer for every single person, it's going to be very tailored.
Have the time to be individual.
Need. Yeah. To be individualized, which I know Jen has done this for a long time. And so I'm excited that you're going to hopefully have this opportunity with lots of people. I do want to ask about a few specific things that I get questions on, and they may not be as long answers as we've had on these first ones, but just kind of some interesting questions I get that I think maybe you guys have some answers on. One would be intermittent fasting, kind of a buzzword right now. Is it worth it? Is it bad for you to be fasting? Like, is that a good, healthy strategy?
It changes by the week, I think.
I was going to say, I think the jury is still out. I don't think we know. I think there are some settings where it can be helpful.
Okay.
But then I think there are some settings where it can be detrimental. And it's not a one-size-fits-all answer. And so there again, having an opportunity to sit down with a woman and learn what her specific goals and needs are can help us know whether intermittent fasting would be appropriate for her. I think if we have someone where there's significant metabolic disease and obesity, then maybe using intermittent fasting or time-restricted feeding where we're eating during a certain window of the day and stop, whether that's starting at 8 in the morning and stopping at 4, or starting at noon and stopping at 8, whatever it is, whatever works best for someone. And I think also when you eat, when you have your window, kind of depends on when you wake up. But having a specific window for which they can eat can then help them restrict calories. But on the flip side of that, I feel like it's very challenging for a woman to have a set window to eat in and get their protein needs.
Protein is so important, and it is so hard to eat that much food.
It is.
And when you then restrict that window, it can be really difficult. I eat a lot of, I'm eating all day. I eat a lot of protein. You cut down my window.
Yes. It can be challenging. Well, and the window.
You guys see me with my food at my desk all day.
Window usually. I mean, you got kids going to this and some emergency comes up here. I mean, life doesn't always fit into a window either. It can be challenging.
It doesn't. And you do want to eat with your body's needs as well. And you want to eat when your cortisol is higher, which is going to be in the morning. And so waiting until 11 or 12 o'clock in the afternoon might not be the best thing for a woman, especially if she doesn't have these metabolic conditions that we really need to try and lose a lot of weight for. And she's just trying to figure out what is healthiest for her.
Mm-hmm. Yeah, there is the risk of losing muscle mass when we go through periods of time, through periods of fasting. For some women, there's really good evidence depending on what study you're looking at. There's really good evidence that it helps with inflammatory conditions, that it helps with weight loss.
And brain
and then you
cognition.
Look at it, and cognition, all the things. Then you look at another study and they're like, well, it's not that helpful. I don't know that I can find many studies that focus specifically on women over the age of 50.
Yeah.
So
we need that.
Wouldn't that be nice? Maybe we can do that. On the 25th hour of our day.
Yes.
I mean, some people swear by it. They say this really helps me feel better. I feel like I am able to meet my goals.
And fantastic.
And so I do feel like this is one that fits in that kind of tailored to the individual. I've personally done intermittent fasting and actually feel really good. I usually cycle in and out of it. Like I don't do it every day. And I've had positive experiences with it.
Mm-hmm.
I just don't know that that's something you can apply to everybody.
Nope.
And so it is maybe one to consider, to talk about,
Definitely.
to see kind of what their life,
especially as a method for caloric restriction in women who are struggling.
Yeah.
And there are, if we get into the weeds of longevity and some biohacking, for very specific individuals, I can see some cases where it would be fun to experiment with.
That's true. But I mean, there is some evidence that might help with insulin control. Yeah. And so it's one that's a little gray area. And I do think some people have success with and some don't. So it is one to talk about. I don't think I would say, oh, it's terrible. I also wouldn't necessarily say it's for everyone.
Exactly.
Mm-mm. Yeah, I think it depends a lot on existing muscle mass and the quality of the nutrients that are being jammed in that short period of time.
For sure.
Not cookie balls all day.
I mean, listen, you're an individual.
Darn it.
I mean, I guess if we're talking weight loss or diets, like what is a good number? I get that question a lot. Like how much is okay to lose over a certain period of time? Like what's a goal I should have for losing weight? If I'm actually, that's kind of where I'm at right now, is trying to improve where I am with my weight in relation to my muscle mass.
For me, an initial question is how much weight do we need to lose? And how hard do you want it to be?
That's fair.
Because if we're looking at 10 pounds and we don't have, I mean, if we have a wedding that we got to lose this 10 pounds in this certain amount of time, then okay, we will have to cut a certain amount per day, depending on how much time we have. But if it's just, I want to be healthier and I need to lose 10 pounds, then we're going to do it slower because it's just easier. It's less stress on the body and it's easier to maintain. And you can cut 200 to 300 calories a day and have that not be too hard on someone and have it maybe not affect their intensity when they exercise or their activity and steps and the NEAT throughout the day. So I feel like their goals are
kind of part of that discussion.
That you have to ask,
for sure.
Mm-hmm.
What do you think?
Yeah, I mean, I think the general answer in like the health space is 1 to 2 pounds a week is a relatively healthy weight loss.
Yeah, that's
and when you talk about somebody who's got a BMI over 35 or 40 and they start making even just a few lifestyle changes, it might be a little bit more than that at first. And I have to talk to them about making sure that we're building muscle, and then making sure that when the weight loss kind of tapers out and slows down, that we don't get discouraged. And
there's definitely a honeymoon period right at the start.
Yeah, especially when there's a significant amount of weight to be lost. Yeah. So I think the generally accepted answer is about 1 to 2 pounds a week. Yeah. But that will fluctuate a little bit.
If you're losing 5-10 pounds a week, you get to that point where you're not feeding your brain and your body's going to have a hard time functioning. You're going to start dealing with mental health issues. Like there's some real
nutrient imbalances lead to hormone imbalances, lead to,
So it's a common sense area. I think that 1 to 2 pounds. And I think just like everything we're talking about today, it is very tailored to the individual. And so having someone to follow up with, talk to about it is really helpful, I think, in kind of getting a number that's safe and healthy for each individual. Mm-hmm. Well, speaking about weight loss, I guess another big buzzword is BMI, body mass index. Mm-hmm. And I feel like that one can be really confusing for people because, certainly an NFL linebacker who weighs 240 pounds with 3% body fat and a guy who's 5'3" and weighs 240 pounds with 35% body
5'3" and 240. That's a big guy.
It's gonna be a different scenario, right? One's muscle, one is not muscle, and certainly I think all of us would agree one is a much healthier situation than the other. So tell me a little bit about body composition. Like, what's a healthy body composition? How do I measure that? How do I find out about it?
Yeah, I like body composition over BMI because it takes that into account. I know even in my personal body scans, I get really proud because I'm like, oh, my weight hasn't changed, but look at my bone density and look at my muscle to fat ratio.
Yeah, maybe just tell people, what is a body scan?
Yeah,
what are you
so
talking about?
A body scan can be done. What's the device that
Intone.
Your favorite device? Yeah,
the Intone body scan.
The Intone,
that's what we will have at our clinic.
To help.
There are devices that will actually differentiate between the muscle, the fat, the bone density, and water. Usually is the other component that they're differentiating between. And for women, what we like to see as far as body composition changes depending on your sex, depending on your age. But for women over 40, somewhere between 20 and 30% body fat is considered pretty normal, pretty healthy. If you get into the more athletic range, and it's like 15 to 20, you get any below 15% body fat, and we have a problem. Yeah. And that is a better indicator. And you will see changes in that or changes in lab values. You see triglycerides go down, but you may not see the number on the scale go down. You see systemic inflammatory markers go down. So these are all really good ways to gauge whether or not your lifestyle interventions are having a profound impact on any of your biomarkers. Whereas BMI focuses on height and weight, and all these little intricacies and nuances are not taken into account.
And what we might see too with our peri and postmenopausal women is we have a woman who we see for her annual every year, and guess what? Her BMI is not changing. Good for her. But if we're following body composition, what we might see is the average trend, where in premenopausal women, their visceral fat is about 8%. And they become
explain visceral fat for the audience.
The visceral fat is the fat that basically wraps around your intervisceral organs. And it's very important when we're talking about metabolic and cardiovascular health. Yeah. And we see it go up from 8% to 23% in a postmenopausal woman without any changes.
Yeah. And that's a big risk. That changes your cardiovascular risk dramatically.
But her BMI might be the same.
And it's not something that you necessarily look in the mirror and see. We see, a little bit once we get up to
start to see that little belly bulge.
20%,
a little bit.
Little belly bulge.
But it's less obvious than the other ways that we gain weight. And that visceral fat in around our organs is one of the better indicators of overall health.
And if we have a way to assess the body composition by doing a body scan, we can track that, and we can track what progress is.
Yeah. It's really the only way to track visceral fat.
So then you can see if you're losing weight, am I just losing all my muscle mass? So that's not helping you in your longevity. That's actually maybe even worse for you to lose all of your muscle mass while you're losing weight. So I think it's probably almost invaluable for someone who's really wanting to get to the point where they're decreasing the risk of cardiovascular disease, decreasing the risk of diabetes, is to know what that number is and what they can do to make that change. And the only way to do that is to be able to measure it. So doing something, measuring it, then doing something with your diet or exercise, measuring again, then you learn and you say, wow, okay, this did this for me versus this did not what I wanted. And now I can change and modify.
Yeah. And really people will get to a point where that number on the scale means nothing. You know, it does when you've got a BMI that's really high and you start to see it go down. It does
Feels
have
good.
some meaning.
It feels good to see.
And it does encourage you and all of that. But you'll get to a point where the number on the scale really doesn't mean anything. Really, it's that visceral fat, the body composition. It's your biomarkers in your blood that will start to tell us whether or not you're in a healthy range.
Right.
Yeah. And people can be a ticking time bomb and have no idea because they just have never even found out what that is. So for sure. Okay. Well, let's talk about some medications. I think that's another question we get a lot. I mean, sometimes it's hard. A little boost is not the end of the world. You know, there's obviously some very popular weight loss medications that are going around right now. Maybe just give me a rundown on which medications are out there that you know about and what are the pros and cons?
I think there's probably not one person in the room that doesn't know about semaglutide.
Semaglutide, yes.
That is the new medication that's being used for probably 4 out of 5 people to help them lose weight. And I am grateful for these medications. I think they're amazing. I think they are really helping us target this obesity issue that we're dealing with. And I think they're very attainable. And very safe.
Yeah, especially in our type 2 diabetics. It's been really invaluable.
I know that a lot of people, you know, depending on the information that they've been given, might feel that they're very expensive, which in actuality, they don't have to be. Getting a prescription from a regular pharmacy, they can be very pricey and not always covered by insurance if your insurance doesn't.
Almost never covered by insurance. Yeah.
It's very difficult to get insurance authorization.
It can be
for these
several
medications.
$100s per dose.
Thousands.
About over $1,000 a month. Yeah.
But getting these medications from a compounding pharmacy where it is equally effective and equally as safe can be significantly cheaper and more cost effective.
Yeah. And I do, when people first started using them, I felt really cautious about it, but I do feel like we have the evidence to support their efficacy and their safety. Semaglutide is a GLP. I like tirzepatide because it has that additional GIP mechanism of action. I'm really excited about one that should be coming on the market real soon, the retatrutide, that has a third mechanism of action. And, you know, we'll be excited to use that and implement that into our care as soon as it's available. But the ways that they work help you become more sensitive to insulin. They also have delayed gastric emptying. So there's an appetite suppressing effect. Just one of the safety things I feel like everybody should know is if you're going to have surgery, you got to make sure that you get off these medications about 2 weeks in advance.
And I think some are saying 3.
2 or 3.
There are precautions that have to be taken if you've been on it within the 3 weeks.
Yeah. And for a lot of my patients, it starts to really effectively help them lose weight. But because their appetite is so significantly suppressed, they're actually not getting enough of the nutrients they need. So they get really tired.
Right. And they lose muscle.
And they lose muscle. So there needs to be an emphasis on maintaining muscle, on adequate nutrition. But they are very, very effective. And we're starting to see evidence that they're very effective for a lot of other things, you know, for anti-inflammatory, for microdosing, for inflammatory conditions, you know, for their renal protective. There's lots of different things that we're finding that they're really useful for.
I have had some patients have a significant reaction to them, meaning either a quote unquote allergic or it makes them so nauseous they're vomiting. And I think it's important to realize that these might not be true reactions or allergies, but that they're started on too high of a dose.
Yeah, it's really
and so
common
it's
to do
important
that.
to have a provider who knows how to dose these medications appropriately so that your body does tolerate it.
Right. And you're getting follow-up. So you don't just
Yeah.
get a prescription and then you're never seen again.
Right.
I have had patients in the emergency room for fluid imbalances because they have such severe nausea and diarrhea. And then I find out that they were started on, 10 milligrams of tirzepatide. And I think,
Right.
oh, good grief.
Yeah.
So we go start low, go slow, monitor the side effects, monitor lab values, make sure that we're talking about optimal nutrition. Some of my patients struggle so much with appetite, they just aren't ever hungry. I have them set alarms on their phone and keep some beef jerky around, just to make sure that they're actually eating. So they're really popular. They're really effective. The science is really good behind them, but really important to make sure that you have somebody that is spending enough time with you, giving you enough education and following you closely enough to monitor them appropriately.
Because one of the concerns too is that they're not following their nutrition well enough, and they're losing weight and they're watching the number on the scale, but they're not paying attention to their body composition and they're losing all of their muscle.
Yeah.
They get really frustrated because they're like, well, I'm only losing like 2 pounds a week and my friend's doctor is prescribing her this and she's losing like 10 a week.
Right.
And I think,
that's not,
that is so,
that's not where we want to be.
so not sustainable.
These medications are injectable medications. They're weekly sub-Q injection, which really is minimal pain. They're very easy to administer. But as a peptide, there are also ways that they can be combined with other peptides, which we'll be talking about soon.
Yes, so we'll be talking about
that can
peptides.
actually help maintain muscle mass as they're losing weight.
Yes, and we'll have a whole nother podcast on that. One of the things I like to address too is just the cost prohibitiveness of it for some patients. Obviously, we talk about the pharmaceutical grade ones that are sold at Walgreens and Costco and all the regular pharmacies, and those are really tend to be too FDA approved, tend to be too expensive for people. And then we have the compounding pharmacies that make them for much, much cheaper. They're highly effective.
They're still
we
FDA
love them.
approved.
They are still FDA approved. They still require a prescription. But then we're talking rather than over $1,000 a month, we're talking like $250 to $300 a month, which for some people is still very cost prohibitive. So I do like metformin. Metformin is a diabetes medication that increases your sensitivity to insulin and helps you utilize your glucose a little more effectively. There are a lot more GI side effects, but it is very cheap. And that's an option for a lot of people. I don't use phentermine as much anymore.
I use it from time to time, but it does have some restrictions because it's a stimulant.
Yeah.
And so for some women, it makes them feel anxious or it makes it so they can't sleep at night.
The heart starts racing.
And so you do have to follow them. You have to see them. I usually will see my patients monthly and I'm following their blood pressure and I'm following, all of their other lab markers, but just talking to them. Are you sleeping? How are you feeling? Do you feel anxious? Because those are some of the side effects from that medication.
And as appetite suppressants and for people with specific psychiatric conditions that contribute to their weight loss, the naltrexone and the Wellbutrin and are effective for certain populations. And then I have a lot of women that really don't want pharmaceutical agents, whether it's a peptide from a compounding pharmacy or it's a prescription. And then we talk about natural supplements as well, because there's actually really good research behind berberine, myo-inositol, and green tea extract. And so for a lot of women, we can incorporate that into their regimen if they're having too many gastrointestinal side effects from metformin or from the GLP injectables. Sometimes we can increase their insulin sensitivity with something like berberine, and help them get a little more bang for their buck with their efforts, and with fewer side effects, or that they're just more comfortable with non-pharmaceutical agents.
I think that bottom line is there's a lot of options. And
there are a lot of options.
It's really important to have someone help you through that process because it's just, I get real nervous when people are just doing a little online something and then there's no follow-up, I'm like, oh yeah, I really think
dangerous.
it's a good idea to have some follow-up and be seen by someone who can go through your individual situation and then tailor your therapy based
Especially in this world we live in where we're just so constantly assaulted with information and we don't know what's accurate and we don't know where it comes from. And it's so hard to understand what's in the food that we eat. You almost need a degree to read a nutrition label.
Yeah.
So it becomes really difficult.
It can be very complicated and more isn't always better. So this dose, just because it's higher, doesn't always mean that's what you should be using. And that can be kind of scary. And there are some side effects that can be pretty dangerous. I mean, I had a patient get pancreatitis on a semaglutide. And so, there are some things
Gallbladder issues.
Yeah. And so I think it is important to be informed what's out there and then make an informed decision on your health.
Exactly.
Okay. Well, we're getting to the end of this one. I think always I like to ask what resources you guys like that are out there for nutrition and exercise. I know you mentioned a couple of apps that you like, but just, I guess, the generalized question, what are some ways that you guys think people can get information on both diet and exercise?
I have a hard time recommending anything other than a visit with a healthcare provider.
It's a good start.
Really,
for sure.
because that way you're able to easily know what might be best for you, because there's so much information out there. It's hard. And a lot of really misleading things that sound amazing when you hear it on Google or YouTube.
It's true. There's actually no shortage of resources readily available.
There's not, but you just need to find the right
whether or not they're actually good.
So I would highly recommend just come and see us. Let us talk to you.
Yeah, I think that's a good starting point. I do think it's helpful to have calorie tracking apps. It is helpful to have friends that are involved in your process. I do think it's good to do research. Like, that's a great thing. I think it's good to be out there and try to find out, because that's what gives you questions to come talk to us about. Reality is everyone's so different. And so there is just isn't a one size fits all. So it does take a little bit of tailoring to your situation, I think, to give you the best results that you possibly can have.
Great.
For more information, you can come to our website. It's valleyhawk.com. That's HAWC. Obviously, we are happy to work with you if you want to come in and see us. Thank you so much for your time.